Dr. Sunil Aggarwal, and thank you for sharing your infinite wisdom with us with our Canna We Talk, Shasta Lake. Stop the hate, educate, providing information and education of the scientific kind. We are so grateful to have you. Dr. Aggarwal,
yes.
My first question, how about we demystify marijuana? Starting with, what are THC and CBD?
Sounds good. It's really great to. I hope everyone can hear me okay there in Shasta Lake. I wish I could join you this year, but my schedule doesn't permit it. So I'm going to talk to you remotely like this, and I'll meet you afterwards for a live Q&A. So
thank you so much for that. We really have a lot of questions and need some very, very good answers. Thank you.
You're most welcome. So I'm right speaking to you now from Seattle, Washington, and I'm going to start by doing some demystification for everyone about what marijuana, or which is the Mexican Spanish slang word for cannabis, is, and what THC and CBD are. So cannabis, marijuana, is a traditional medicinal plant. It's about 37 million years old on planet Earth. It evolved somewhere in India, China, like Central Asia region, and around the same time that the Himalaya mountain range was being formed, and in the same area where the Himalayas was being formed, and that's where the Indian subcontinent collided into Asia. And the reason I tell you that is because cannabis had to survive in an environment that was getting higher and higher in elevation every year, because it's the tallest mountain range on Earth. It had to adapt to the increasing UV radiation and sunlight, so it started to produce quite a bit of chemicals in its flowers, resinous flowers, and that's probably where the terpenes and cannabinoids and flavonoids, these compounds that are medically treasurable in cannabis, they probably evolved in that type of environment all those tens of millions of years ago. And so there's tons of genetic diversity in cannabis, tons of varieties, and nowadays as we're becoming more scientifically thoughtful and chemically thoughtful about how we want to utilize cannabis, we are interested in the cannabinoid class. And there may be about 112, 115 naturally occurring cannabinoids in the cannabis female plant resin. But the two that we've studied the most closely and carefully are THC and CBD. Those are acronyms for tetrahydrocannabinol and cannabidiol. And they actually, they were really nicely characterized about in the 1920s by a guy, Roger Adams. He was a chemist in Chicago. He had figured it out. He didn't get exactly everything right. That they didn't have the same chemical techniques for mapping out molecules in those days. Oh, actually, it might have been the 40s. Excuse me, not the 20s. It was the 40s. But then it had to wait until basically the early 60s, when Raphael Mechoulam in Israel at one of the universities there was able to really nail down the exact structure. So what you should know about THC and CBD is that they are isomers of each other, which means that they are made of the same atoms, the same number of carbons, oxygens, and hydrogens, but they're just arranged slightly differently. And I'm using my hands here to make an example. In THC, there's a ring that's closed, and in CBD, that ring is open. And that's the main difference between the two molecules. It's at the structural level. At the pharmacologic level, the drug effects level, they really are yin and yang to each other in terms of what they do in our bodies. THC has anti-pain properties or analgesic properties. It has euphoric properties. It has anti-anxiety properties, anti-spasmodic properties. It regulates a whole number, bronchodilation, a host of activities. But it's characteristically what's been used for kind of in social realm and in spiritual realm too, is it's a way to elevate consciousness or to give people a sense of well-being, and which and sometimes it makes people's short-term memory a little bit hard. It interrupts the flow of short-term memory. It doesn't mean that there's not memories being formed, but sometimes there's a subtle alteration that can be bothersome for some folks if you're trying to do something. Sometimes it helps people focus more, actually. So anyway, it has those properties. CBD doesn't have that kind of acute properties of causing that kind of interruption in short-term flow. It actually does, it blunts some of the worst effects of THC, some of the anxiety-provoking effects of THC, which it can, even though it's anti-anxiety, it can also provoke anxiety. It blunts some of the dissociative effects of THC. And that kind of thing. It seems to make you tolerate THC a lot better. And on its own right, CBD has some nice properties, anti-seizure properties, which the whole world found out because of the CNN specials with the children with the genetic seizure disorders. It has anti-anxiety properties. There's been studies in Brazil where they've given it to people before they give speeches in controlled settings, and people who have tremendous phobia of giving public talks, and they do better with when they have CBD capsules beforehand. And it has it also has pain relieving properties, antispasmodic properties, etc. So these two compounds are very impressive in their own rights individually, and together have really nice properties. And in both cases, when you combine those compounds with the other constituents that occur in the cannabis flower, terpenes, flavonoids, the things that, like I was telling you, that also evolved when the cannabinoids evolved, that those compounds are also found in other parts of nature. They're found in limes. That's what gives lime its nice smell. It's called limonene. Or in pine forests, the smell of pine trees is caused by a chemical called pinene. And there's a compound in mangoes called myrcene. There's a compound in pepper called beta-caryophyllene. All of these compounds occur in the cannabis resin as well, the terpenes. And it seems like when you mix those terpenes and flavonoids with those cannabinoids, with, let's say, a THC dominant or CBD dominant or a mix of the two, when you have those other compounds in there, you take it into your body, it's called you get an entourage effect. You can get a better effect with less THC and CBD on board. And that's very nice. And so that's kind of that's how THC and CBD can be most effectively used, is in the context of a whole plant extract or a whole plant vapor, or however.
Well, that is very good. Okay, so could you explain further, maybe, because I think you handled seizures pretty well there, but how about how it affects cancer or maybe PTSD?
Yeah, I mean, there's so many. There was a recent report from the National Institutes of Health. The director of one of their institutes, that's all taxpayer funded. It's the largest research hospital in the world and the largest funder of health research in the world. I spent a year there last year doing my fellowship in hospice and palliative medicine, so I can tell you it's quite a place. But
I would imagine.
One of the researchers there co-authored a paper. I mean, he's the leader of an institute, and they said that one's named Kunos and one's Patcher. They said in a recent article that essentially every human disease, the cannabinoids, and not just the plant cannabinoids, but we also have naturally occurring what we call endocannabinoids in our body, that they are involved in virtually every disease. So it's a huge number of potential conditions that this cannabinoid science could be relevant for. It's just like there's many medicines that we have that can be applied to lots of different things. So this is a nice one. So particular interest right now in terms of really seeing some really impressive things on the horizon: neurologic disorders and oncologic issues. And I think PTSD is kind of a neuropsychiatric condition, so you could add psychiatric issues there too. So let's start with cancers. So the cannabinoids have anti-cancer properties. They have been demonstrated in many studies in labs across this country and in the world. to have effects in animals, in petri dishes, and in small recent human studies to actually arrest the growth of many types of tumors. Breast, brain, lung, blood, pancreas, and you name it. Quite impressive. There's probably three mechanisms that we think that are generally involved. Number one is stopping the blood supply, the new blood vessels. Then when they go to solid tumors, to have a solid tumor grow, it has to have new blood vessels, and tumors release chemicals to make blood vessels grow to them. And cannabinoids seem to interrupt that chemicals process. It's called anti-angiogenesis. Cannabinoids cause tumor cells to kill themselves, programmed cell death, pro-apoptotic is what that's called. And they seem to also prevent the invasion of a tumor through a tissue, which is a process by which solid tumors metastasize. So those are some of the things that research has shown, that cannabinoids the ways in which they can have anti-cancer properties. And this is not just sort of fringe science, somebody in some lab someplace that's not been replicated. It's been replicated over and over. And the National Cancer Institute, which is the world's largest funder of cancer research, has collected information both for patients and health professionals, and put it out to the public on a place called the Physician Data Query, Cannabis and Cannabinoid Health Information Summary. And you can go to this on cancer.gov, which is our taxpayer-funded public website.
Very nice.
Yeah, it's nice. And so any of your doctors out there, patients, look at this stuff. It's vetted. It's peer-reviewed with a board. I was actually a member of the editorial advisory board, and I've submitted some of the material there. But it's been growing, and it's a solid resource. So cannabis and as a potential anti-cancer agent is very exciting, and we need lots and lots and lots of research and trials to really figure out what variety, what kind, how much, for what condition. And I think I do believe that doctors and patients can do this together under supervision, medical supervision, so that they can track changes. They can kind of try to figure out what things there might be out there in terms of ratios that might be needed, how much. It's not. I think it's a experimental treatment that's necessary for people's sense of hope, and also it's not just as a separate treatment, but potentially these cannabinoids can help to make standard chemotherapy and radiation, which is our standard treatments in cancer in most of the world, modern medicine, and can help them become more effective. And that's been shown maybe in animal studies where they use a drug that treats pancreatic cancer. It's called gemcitabine. If you have some cannabinoids on board, it seems to increase the killing power of that. At UC San Francisco, they recently did a study where they used temozolomide, which is an oral agent for glioblastoma, a brain tumor that killed Senator Kennedy. They combined that with a THC CBD 1-to-1 extract. So, and I think the study is done. I'm still waiting to see what the results showed. So it's not just a separate treatment, but potentially as a complementary treatment to standard therapies. And then, aside from all of that, aside from treating cancer, having anti-cancer properties, there's tremendous data that shows that cannabis and integrating cannabis therapeutics into cancer patients' treatment can help to palliate or cloak symptoms of cancer and its treatment effects. So it's like pain, nausea, vomiting, loss of appetite, anxiety. So it's those are pretty, and I think depressed mood too. I think these are very powerful negative symptoms that people face, and when they face those, they don't feel like doing further cancer treatment. Certainly they can lose a lot of meaning and purpose in their life. So there's a lot of spiritual and existential distress when you face an illness that can be potentially fatal or is in many cases. So I think there's also a role for palliation of those kind of symptoms as well. So cannabis and cancer, that's a little bit of it. Cannabis and post-traumatic stress disorder. PTSD is also a very up and coming, exciting area, and we really have only scratched the surface. But I think we're going to get more information as more research continues in this field. But many people have attested to the fact that so what happens in PTSD is, there's certain parts of your brain, like one called the amygdala, which is involved in fear conditioning. It's basically kind of short-circuited. You have these triggers that put you already into this panic mode, a fear-conditioned mode, and this can cause nightmares, flashbacks, can be very disabling, night terrors, anxiety, all irritability, etc., etc. And I think we've got a lot of that in our, not just the diagnosed PTSD, but I think a lot of trauma in our society. So anyway, I think what people are saying is that, and this has been shown in animal studies too, is that cannabinoids can help with what's called the extinction of aversive memories. This is a fancy way of saying that. So that cannabinoid system, the endocannabinoid system I was telling you about, is involved in the way in which our brain lays down memories and associates certain emotions with those memories. And of course, the amygdala, as I said, is a sort of fear and emotional regulation center. If you have extreme fear associated with a memory, that memory can, and they're just linked together. When you bring that memory up, an extreme amount of fear will come with it. And so cannabinoids can potentially disrupt that aversiveness of that memory and potentially help people get out of that cycle. It's not the only exciting treatment out there that's coming up that I'm really interested in. I think the use of MDMA, or what's on the street is called ecstasy, as a treatment for post-traumatic stress disorder and other forms of what's called psychedelic psychotherapy may be really promising as well. And in those cases, you might just need a few sessions to have long-lasting effects. But I think cannabis, because of its ability to really work gently and slowly, will be a great salve for these symptoms as we continue to use that. And many states have now approved. As you know, California had the first medical cannabis law, and there was no condition diagnoses. Many states after that added condition lists, and in many of those states they have since added PTSD or put it in from the beginning, because there's so much excitement, especially from the military community, veteran community. And I think that would be a really excellent if people started to understand for what their body chemistry and their condition, what way that cannabinoids and what type of ratio will work best for them. In some cases, it might be a high CBD because of the anti-anxiety properties of CBD, or it might be a 1-to-1 CBD to THC or some other variation. So it's the medical approach to this is not a one size fits all, because our body chemistries are all different, and the endocannabinoid system is so vast. But I think the fact that the endocannabinoid system is so intricately involved in the parts of the brain where PTSD we think is taking a hold gives us a lot of hope. There actually was a study at NYU recently where they showed in brain imaging that the endocannabinoid system is upregulated in those patients who do have PTSD, meaning it's sort of ready for more input. It's our body's way of having to deal with this, trying to deal with it on its own, is to try to sort of jump start the area in the brain that helps us forget those things. But sometimes we need some medicine to help push that along. So that's a little bit of cancer and PTSD. Do you have specific questions about that?
No, I don't. I think you've got that covered very well. I do have a question on, can we discuss your thoughts on the safety of medical cannabis compared to over-the-counter drugs?
Sure. Yeah, I mean, the safety issues, of course, is what originally the government said that we had to get rid of this plant for in the first place. They said it would lead to homicidal mania if we used it. So that's kind of I think there's been a lot of politics and misinformation around the safety issues around the use of cannabis. But I think let's be real. We don't have any, first of all, overdose deaths. You cannot die from using cannabis. Period. Full stop. It's not lethally toxic to the body. Now, you can't give yourself schizophrenia using cannabis. You just can't do it. There's some concern in certain vulnerable young people who may have certain genetic predispositions that use of cannabis may trigger earlier onset of a chronic psychotic disorder. We don't know if that's if there's a causal link there or there's just an association. So it's a little bit hard to say that, but I think certainly caution should be advised in people who have some pre-existing psychotic disorders personally or in their families. Doesn't mean that there's no role for it. There's actually some really interesting data on CBD being as effective as a drug called amilsapride for the treatment of chronic schizophrenia. That was in a head-to-head clinical study in Germany. So it's not that I think there's so many types of cannabis. So maybe for those kind of patients, THC-rich cannabis might not be as safe or as helpful as CBD-rich. So, but anyway, the other thing is, so I talked about death. I talked about chronic psychosis. You're not dead, but you're permanently psychotic. That could be a concern, and we don't have any of those kind of data to make those kind of claims. The other thing would be end organ damage. Is cannabis going to cause my brain to shrivel, my kidneys to not work right, to not filter enough blood properly? Does it cause my liver to go into failure? The answers are no, no, and no. And there's plenty of reason to believe that acetaminophen, Tylenol, can cause liver failure. In fact, it's one of the leading causes of liver failure in this country. It's not. People just don't know. They've tried to reduce the amount of acetaminophen in many drug products to reduce that. Ibuprofen has can cause your kidneys to shut down. Can cause people to have to start to go on dialysis. They can get that bad when people are taking lots of they're called NSAIDs. They can also have bad impacts on the stomach lining. So these are over the counter. All of these, and they do carry significant risk to the end organs. We just haven't seen that in cannabis. So there's really no need to track your end organ functions like through metabolic panels or blood tests. If you are taking other medications that are potentially toxic or have a narrow therapeutic window, like lithium or like certain anti-seizure drugs, there is a reason to think that maybe certain types of like CBD can maybe change the way that drug metabolizes in your body. So you have to maybe check the level of the drug and make sure your blood level is staying the same, or maybe you need to lower the dose of that drug so to keep the blood level the same, because that's called a drug-drug interaction. That's not very common, but I do want to mention that since there's all kinds of medical situations that people might have. So that's a little bit about the safety.
Well, thank you so much, Dr. Aggarwal, for this very informative presentation benefiting Shasta County, Canna We Talk 3. Now we're going to head up for the question and answers, all with Dr. Aggarwal. And Dr. Aggarwal, you're going to need to get ready for this because I'm sure there's going to be a zillion questions for you. Thank you so much.
Thank you so much, Dr. Tammy. I look forward to the Q&A. You guys have a nice day. Bye-bye.
Thank you so much.